Good morning and welcome back to the show. Today with us, we've got a slightly different episode, which is with the wonderful Bev Coghlan, and she's going to be really taking us through her journey and really telling us about how she got so involved and passionate about women's health, in particular vaginal health. And I think her story is a super inspiring story and something that I'm really glad that she shared with us and is going to share with you guys on the show. So I think, yeah, firstly, I think it's just great to say welcome.
Hello, and thank you for having me.
No, anytime. And I think, Bev, you've obviously had a real journey and a struggle with your health, in particular your vaginal health.
Yeah.
And I think it would be great just to kind of take it all the way back for listeners and
Right.
really the people that may be going through similar things and really just start from the beginning of your journey, if that's okay.
Okay, no problem at all. So for me, it started, my issue started in 2018, which is approximately sort of almost, well, it is 5 years ago. And what I thought I had, which I think many women, probably the majority of women have had sort of thrush in their lifetime, unfortunately. It's one of those things, it can be triggered by anything really, can't it? And I thought, well, I feel a bit uncomfy. I'll just nip to my pharmacy, grab myself a pessary, which I've done before with, success. Never had any other problems down there before. And did the pessary. And about a week later, I went on holiday. A week later, I thought, still don't feel quite right. So I thought, I'll go and do another one. So I did a second one. And a week later, I still wasn't quite right. And I thought, well, this isn't usual for me. This isn't normal. So I left it another week, and then I went to see my GP, who took a look like they do. She didn't really think there was anything going on particularly, but she said, just, I'll do a swab. So she did a swab. Just to be on the safe side, I'll give you a course of antibiotics. So I took the course because that's what you do. You have every faith and you think, well, they've given it me for a reason, so I'll take it. In meanwhile, I got a bit worse. I was a bit more uncomfortable, and they lost my results, or something happened with my results. I can't remember what happened. There was either something written down wrong, but they weren't. They were, unfortunately, they couldn't be. That swab couldn't be used. So I had to do another one, which I did. But in the meantime, I had still taken the antibiotics that I was prescribed. When the swab result came back after the second swab, it was negative for the usual suspects. So there wasn't any thrush, there wasn't any BV bacteria, or the ones that they test for on the general swab. So I'd taken obviously antibiotics kind of for nothing, just on the basis of a little bit of guesswork. After those antibiotics, I wasn't any better. If not, I was a little bit worse. And I ended up, I think by that point, I was getting quite worried because I thought, this isn't normal for me. I know my own body. This isn't how I normally am. And I started to think, well, what is going on with me? Long story short, because there's a lot of toing and froing with. I also went to my local GUM clinic, not because I suspected anything down the sort of contagious route, because I'm obviously married, but I just thought I'll just see if they can shed any light on it, because they do all the tests there and they do a bit more in-depth testing. Saw a lovely nurse, she was wonderful, looked after me. Again, the whole thing came back negative. She tested my pH. It was a little bit off. Other than that, everything seemed normal. Again, I was just told, everything looks fine. A few more weeks went by and I started to worry again. And I changed my doctors. I went to see another GP just to get another point of view. And they did another test. She said she could see I was sore, but she did the standard testing again. Sent it off and it came back negative for everything. So I was just being told there's nothing wrong with you. But my symptoms were irritation, soreness. I felt like my insides, if I was going to describe it, were sort of almost stuck together, like I was almost rubbing together inside. I was inflamed, really. That was the worst symptom. So I think at that point, I can't remember if I was prescribed another set of antibiotics or not. I don't think she did that time. But then I think I came away from that GP. I can't remember exactly what the order of things are, but I think I came away thinking, I don't think she's going to be able to help me. So I made an appointment to see a private gynecologist, because I was just getting a little bit too anxious about it all, really. I went to see a doctor at the Spire Regency, which is a private hospital close to my home. Saw a doctor there, and the first thing she said when I described what I'd done to date, she said, well, you definitely haven't got thrush. And she just said that as a statement. She hadn't looked at me by then or anything. And then she said, you definitely won't have that. I'll do a swab. So she did a swab. But she said, just to cover off everything, I'm going to prescribe you augmentin. So she hadn't got a positive swab result, but she still prescribed me a course of antibiotics, which I did. I followed it completely. I took every single one. And I think a couple of weeks later, I was even worse than before. So I was even more. I just wasn't, if anything, I was just either completely same or slightly worse. I can't quite remember. And by that point, my mind had I just thought to myself, am I going to be stuck with this feeling? Because everyone's telling me there's something wrong with me. I actually started to then do my own research a little bit. I became a bit fixated on trying to find out what could be wrong with me. I then got a negative swab result, and I'd been given antibiotics. I thought, I don't really want to go back and see her again, because she sort of dismissed me a little bit as well. She sort of wasn't joking about it, but when she said, well, you definitely haven't got thrush, she was sort of laughing it off, as if to say, you've given yourself that much Canesten, you definitely won't have any of that in your body, which I just found I wasn't really keen on her demeanour, because I was really worried. So I went to see another gynecologist at the same place, where he'd been recommended to me by my GP. He was lovely, but the first appointment I had with him was by telephone, and I think by the sound of my voice, because I was quite worried, I think he was concerned that it was in my head and I was sort of imagining it, and he sort of made that suggestion. He also sort of did a profile on me and told me that I was a type 1 personality, which I wasn't sure how to take, because the type 1 personality is a go-getter and you want all the answers now. But I just wanted to get well. And I'm quite an informed patient as well. And my background is a bit medical, a little bit. So I just wanted some answers. And yeah, after a lot of convincing, I convinced him that it wasn't in my head, and he agreed, to see me. So I went in to see him and booked an appointment. And all this, meanwhile, is costing, private appointments cost quite a lot of money as well, private consultations. They're like sort of the initial ones, £200, and then they're £100 follow-up thereafter. Or they were then anyway, they might have gone up now. So I went in to see him, and he was really lovely, and he had a very nice bedside manner. And he basically said to me, we have to undo, I literally wrote out my story like I have for you, Jess. We'll have to undo everything that's been done. You've gone up here, and we need to go right back to basic, which made sense to me. If you've treated yourself with things and you've had things prescribed, you might have put your body even more out of whack. And he said, you've basically got an imbalance, which he wasn't really wrong. So he basically told me to do nothing for a while, and then he prescribed me estradiol cream, and that was for 3 months, and then he increased that eventually to 6 months. Now, during that time, I didn't really see any improvement in my overall symptoms. I was still sore. I still felt like I was burning. The funny thing with my symptoms was as well, my menstrual flow felt like it was actually burning me, which someone else I know has a similar set of symptoms to that, which when you tell a doctor that, they go, well, that's not possible. But something was causing me to be even more irritated, whether it was my skin or something, and the blood was irritating me, I'm not sure. And I know that sort of blood anyway does elevate your pH, so I think it was a number of things, and that was another side effect. I would then dread coming on my time of the month, because I knew I was going to be, that was the worst I was soreness wise. The build up to my period the week before was just horrendous. I mean, I suggested to him as well things like, do I have CV? He did a pH test and it was high, and he said, it's not CV. And then he made this sort of, during one of my consultations, made this comment about, oh, you're not very well protected. And at the time, because I didn't know much about the microbiome, I didn't really know what he meant. And he must have done a test at some point that saw my depleted lactobacillus, but he never said anything to me to enable me to understand that or explain about it. And then in several appointments afterwards, he sort of gave me a different diagnosis each time, which felt quite strange to me. So another time I went back, he said, he thought he'd got the root problem. He said, oh, I can see you've got a polyp. That's maybe the hidden issue. Yeah. So I agreed, had it removed. I had an outpatient appointment, had that removed. And he said, well, see how you go. I think I've got it all. And, let me know how you get on. So I was thinking, well, maybe this is the problem. I know polyps can give off, they can give off a discharge, I think. It was benign as well. There was nothing sinister to do with it. And yeah, he removed it. And then after a couple of weeks, I gave it a few weeks, and I thought, still feel those familiar sensations, that discomfort. I thought, this still isn't right. So I went back to him, and then in another consultation, he said to me, well, I think we need to treat the ectropion. And that came out of nowhere. So he sort of then gave me another diagnosis. And I sat there and I said, well, where's this ectropion and what is it? Oh, it's when the cells it should be on the inside of your cervix, go on the outside. I was like, right, well, okay. And I'd never heard of it. He'd never mentioned it before. And I thought, well, surely if he'd seen it before, he would have mentioned it at a previous appointment. And I just felt really a little bit kept in the dark. And I thought, this is all going on in my body, and you're not divulging this to me. And he said, well, we'll need to freeze it. Or there were several different options. I had cryo in the end. Meanwhile, we had COVID, so I couldn't get seen for a while. So I went, but he did, he kept in touch with me to check on how I was, which was very kind of him. And then after COVID, when we could start having appointments and things again, I went and had my cervix cauterized as an outpatient. It was all right. It wasn't particularly pleasant. And I thought, well, that's surely got to be it now, because I'd read about ectropions as well that can sometimes cause vaginitis because of how they are. They can cause desquamative inflammatory vaginitis. Read so much that, you find a link. You find a link in everything. Yeah. So once I'd had it done, I waited about 4 weeks, and I realised that I was even worse than ever. So then I had this immense irritation as well. I felt like it was just really an odd sensation. I then, coupled with soreness, I was then just really, I felt like it was crawly inside. I can't quite put my finger on the exact feeling, scratchy kind of feelings. And I thought, oh, this isn't right. So I went back to him again, and he said, well, and after everything he'd done for me and tried to get me to stop doing antibiotics and canesten and everything, he said, right, well, I'm going to give you metronidazole for the BV. And I looked at him and I said, what makes you think I've got BV? And he said, well, that's probably what it is, sort of thing. Yeah. And he sent me off, and I just lost all faith in him. Then I thought, you are the person I've had all this faith in. I've waited to see you. I've gone through all COVID, and you've not done a swab, and you've told me I've got BV. So I went to my GP, and I said, this has happened. And she knows my story, my history. And she said, right, I'll swab you. She did a swab, and she texted me back. I think I got my text within about 2 days. She was amazing. And she said, don't do the antibiotics, you've not got BV. So I just thought, what am I going to do now? I felt that was my lowest point. I thought, it's what I haven't touched on yet in all of this, I've just given the story, is the mental impact of it. It's the relentlessness of every day you're sore and you don't know what's causing it, and everyone's telling you that there's nothing wrong, but you know your own body. Yeah. So anyway, she told me that I didn't have it. So then I was thinking, I don't know what to do. And I've done a lot of research, and I'd come across a blog. Online. It was a lady who'd found a doctor in London because she had cytolytic vaginitis, which is CV, which is when you've got too many good bacteria. And she found this doctor in London. I had a successful treatment with him. I managed to overcome it, or got better from it. So I made an appointment to see him, a private appointment, and I got on a train. I went to London. He was very nice, and I was just hoping on the train this man was going to be able to actually help me, because I was probably about 3 years in at this point overall. And yes, I went to see him, and he did a thorough examination, took swabs and everything, which, when I had my results back from that initial consultation, didn't show an awful lot. Things weren't quite right, but didn't give him much of a picture. So he said to me, what I want you to do is, I'm going to send you some slides, do them when you're most symptomatic. And they are just a glass slide. You do your own swab, and then you do the swab you put it on the slide, and you send it off to him, and he does a gram stain of it. Which I was thinking, well, how does that work? Because surely it's dried out in the post, and I thought about all the mechanics of it. I was like, when he arrives, what does he do with it? Anyway, I thought, right, well, he knows what he's doing, so I sent them off to him. And then I got results back, and this is all short story. This is long story short. I got the results back, and it said that he said, you've got AV. First person to say that to me. He said, you've got depleted lactobacillus, and you've got too many cocky bacteria that shouldn't be there. And I actually was over the moon. I thought, finally somebody has found something, because no one has found anything so far, and this man's found something. So he treated me then with clindamycin, which is internal cream. So I had that, thinking, well, that's going to cure me. 2 weeks later, all my symptoms returned. I was completely back to square one. And I thought, so he sent me another set of slides, do another set of slides. So I did those, sent those off to him. I then got the result back, and he said, you've got DIV, which is like the worst kind of AV you can have. It's so your cells that should stick around shed at a too speedy, you'll probably know about this, too speedy rate. I think it's your epithelial cells, and they come off at too fast a rate, which probably was giving me the scratchy, horrible feelings that I had. And I read everything about DIV. I read everything I could find on it. And the worst thing about that is, when you read up on it, a lot of the time people don't ever really get cured of DIV. It seems to be one of those things that can recur, and you can end up being stuck with it, because it's more of a immunological response. But then I was thinking to myself, well, surely there's got to be a root cause. Something is making my body do this. It's got to be. I firmly believe there's got to be a root cause. But by this point, I hadn't heard of any private testing. So he said, well, the treatment for DIV is it's a bit controversial, because it's not actually licensed in the UK. So the treatment, if you read it up anywhere, it's hydrocortisone. But it's not licensed in the UK for use in the vagina. So you can have it for use in other places in your body, for like colitis and Crohn's disease and things like that. So he said, if I prescribe it to you, you'll have to agree that it's off label, off license, which they can do. But I was still seeing him privately. So the cost of the hydrocortisone cream for, I think it was 3 months worth, was £1,500. Wow. But at this point, I'd have done anything. I'd have probably sold my right arm. So I was in that much discomfort. I thought, right, well, surely this has got to hopefully work for me. So arranged a prescription. It was a bit complicated, but I got it sent to me. And I did it all. It was very adherent. It was quite tricky, but I did it all, and hope for the best. And like you say, you've in amongst all of it, you've still got to find the strength to carry on. So I still had a full-time job, got my own business, got my daughter to get to school every day, be a wife and everything. And for me, the hardest part in all of the journey was the hope that each treatment is going to fix you or make you better, and then the realization about a few weeks later that actually no, I'm back at square one again. All my symptoms have returned, and that was the hardest thing for me, was the coping with the come down from the hopefulness of it's going to work,
Yeah.
and then the come down of no, oh no, it hasn't, has it? You know, you're back to how you were before. So that's when I thought. So after I did the hydrocortisone, and I realised that I wasn't better.
UK Health Radio, the station that makes you feel good. UK Health Radio, the station that makes you feel good.
I mean, I even was so convinced it had worked at one point. I actually sent the secretary who'd arranged my prescription flowers. Because I thought, oh, you know, she did go to a lot of effort to help me get it and ship it. So, you know, but then a few weeks later, I wasn't right again. So then I started thinking, there's got to be some other test I can do, and that's when I found a company that does a private test online, as I hadn't yet heard of Screen Me, so I did another one. It took a long time to get it back because I had to send it off to America, which isn't very convenient for someone living in the UK. And also I was worried that it wasn't going to get there. I had to send it by a parcel force, and it was quite complicated. My local post office wasn't helpful at all at this point. And they said I had to send it by a different means, by courier. Yeah. So I sent it off, and then I got the results back. I think it was about 5 weeks later, all in all, from doing it to receiving it, which is quite a long time. But what it did reveal was that I had absolutely no good bacteria whatsoever. So my results were 0 lactobacillus species, which you should be dominated by. And I had a plethora of other really random, not too sinister microbes. There was things like Feingoldea magna, Prevotella bivia, a Bifidobacterium dentium bacteria, which was very obscure as well. And that was like 40%. So it was a real strange mix of people that were commensals but shouldn't really be hosting the party.
And for listeners who might not know, I think your lactobacillus level should be around 95. So for you to be on 0, at least 95. So for you to be on 0 was, it's really shocking. But carry on.
So that was an eye-opener. So I thought to myself, well, this is what's wrong with me. Okay, I haven't got Gardnerella, which would show up on a BB test, and I haven't got Candida, which would also show up on a doctor's test. But what they're not looking for is all these other things which are making up my microbiome, which is completely wrong.
Absolutely.
So that was a starting block, a building block, really. And then I just did loads more research about how I could actually get myself better. The interesting thing about this is once I'd done my private test, this more in-depth test, I took it to my doctor in London, who completely poo-pooed it. Wow. He said, these tests, you can wave a stick between your legs and get a result on that. That was his sort of overall thoughts on it. He went, they're far too sensitive. And I thought, how can a test be far too sensitive? You're doing a gram stain on a slide that's maybe sat in your office for 3 weeks. This got to be more accurate than what you're doing, surely. And interestingly enough, it coincided with me sending him another set of slides back, which showed I actually didn't have DIV anymore. The hydrocortisone, I think it actually suppressed the immunological, it did something for me, I'm sure. But I still had all the other symptoms, like the irritation and the soreness still and everything. So I said to him, would you just look at this test results? And I'd sent them to him as well. Meanwhile, he had my gram stain. He said, well, I don't know what you've been doing, but you've got loads of lactobacillus. And I said, but this test shows that I have none. He went, well, your gram stain shows that you've got loads. So what have you been doing? I said, well, I haven't been doing anything yet. I said, so I don't know how. And I said, is there any chance that what you're looking at is these other bacteria? And he paused and he said, it's possible that they're masquerading as lactobacillus and they might be fusobacterium. And I was like, well, you've just misdiagnosed me, you know,
Yeah,
really.
exactly.
So I thought, I don't really want to lose faith in another doctor, but you don't really, sorry, something's just come off my screen. You don't really seem to know, you know, one from the other just by looking at it. It doesn't seem that accurate under a microscope to me. So I suddenly worried, thinking, I'm not sure how accurate his test is, but I'm going to believe in this. So I got him. I said to him, can you just, you know, look at this? And he said, well, it could be that. So I'll prescribe you cephalexin and clindamycin again. So I did cephalexin together with clindamycin internally. So cephalexin is an oral antibiotic. And we'll see how, you know, because we can't leave you in this state. And I thought, well, you were about to tell me that I had too many lactobacillus anyway, so I won't hammer on about that too much, but it did make me a little bit cross. So I did the antibiotics, both of them, and I thought to myself, it's like a repeat cycle. If I don't do something to repopulate my good bacteria, I'm going to be in this vicious circle where I treat the bad bacteria, they go, but then they probably just come back because there's nothing to build up any good ones. My body doesn't seem to be, and I'm 45, so my body isn't probably as good at making the good bacteria anymore, with probably depleted estrogen levels. So I just thought, I'm going to have to do something. So I actually followed the protocol on the My Vagina website, which is actually really, really useful. And it was a protocol which was basically, I can't remember the ins and outs of it, but it had, you know, it was to do with breaking biofilms as well. And when you read about biofilms, it creates a horror movie in your mind. You think, well, I'm never going to break these biofilms. I'm going to be stuck with these bacteria forever. They're going to grow in me forever, and they're going to create these films, and nothing's ever going to break them. And even if I do break them, they'll come back. And your mind does a really strange thing where I convinced myself that my body was broken. I was never ever going to be right again. I was going to be like this, and I was probably going to die with it. And to cope with that, my GP actually ended up prescribing me antibiotics as well. So I've been on mirtazapine for nearly 5 years. I've just come off it now, just to cope with my anxiety levels over it all, and to get through the daily life of being uncomfy.
Chronic stress on your body for that. I think it's just so sad.
I mean, that's it. And I wasn't sleeping either in the beginning. I wasn't sleeping at all because my mind just went bonkers, really. So so what I did was I took the cephalexin, I took the clindamycin, and then he also prescribed me estrogen tablets in the form of Vagifem, which was twice weekly. So at the same time as doing that, I thought, right, I'm going to make my own capsules. So I made my own using LifeSpace probiotics, which are from Australia, because I've done all my research and they seem to be the best ones. And they contain all the good bacteria. And I did them vaginally every night for 3 months without fail. And then I did the Vagifem twice a week. And it's hard to know how my body has eventually come right. I think without doing probiotics, I don't think I would have resolved. I think I would still be in the vicious circle, to be honest. I definitely, they've got a definite place. And I know a lot of doctors don't really believe in them and say that they're nonsense, and they don't get there. But I think if you put them where they need to be, but obviously that has to be done carefully as well, and you need to make sure that you use the right capsules and things. But if you do your own research and follow a protocol, then so where was I up to? I also started doing a prebiotic supplement as well, because I started having reflexology it started in February this year, just for a bit of health and well-being, really. It's a lady who works closely with us. And yes, so she just said to me one day, she said, would you think any of your issues are to do with your gut as well? And I said, well, I don't really know. And she said, well, have you ever heard of leaky gut? And I hadn't ever heard of that as a thing. And she said, well, I take this thing called, it's called Bimuno. It's just a prebiotic powder. It's a daily supplement. And I thought, well, it can't hurt, can it? So I started doing that in February. So I think because I was being kinder to my body, I did a bit of reflexology. I did it weekly for about 2 or 3 months, and I now do it bi-weekly. Took a prebiotic, continued taking probiotics, and I think slowly my body's gone, okay, you can be normal again. So after my shocking test last year, which was May, I did another private test this year in May again. And I went from 0% lactobacillus to 98.8 good bacteria.
Wow. Well, yeah, I think firstly that just deserves a round of applause. I mean, all your hard work, I think, paying off, and I think the journey to get there is just outstanding. The fact that you had to go through 5 years or more, and to constantly be in discomfort and pain and not be really understood or properly heard, I think is just it's a true testament, I think, to your character and also your perseverance. So I just want to say, firstly, sorry that all that happened, and secondly, that I'm glad that you're feeling better and feeling like you've kind of taken back control of your health, and completely agree with the fact that the holistic side of things, that holistic whole body care, is so important in how you can help to rebalance. And I think your story is also so inspiring because it shows people that maybe in a similar situation that it's not something they have to be stuck with forever. The vaginal microbiome is something that you can change, and it's something that you can make changes in your day-to-day life and make proactive steps to really rebalance. So I think, that's firstly, the first thing I want to say about all of that is absolutely amazing. And well,
it's funny because I'm a member of several Facebook groups as well, because in all of this, you start to feel in the beginning very alone. In my head, because I'm a bit of a thinker as well. All I kept thinking was, am I the only one with this? Are there other people like me? I felt so alone in it. And when I started to research it, I realised there was a whole community of women out there. I'm a member of 3 different Facebook groups. And it astounds me how many people are in a really similar position.
Absolutely.
And they have been, some of them have been 10 years in and they've got no answers. They've got repeated bouts of BV, but have really unsuccessful treatments. They're absolutely desperate. They're on antidepressants, and I've also got a WhatsApp group with 2 ladies who I've met through these groups. And it's there's just 3 of us in this group, and we're all 3 different ends of the spectrum. One has got a completely different condition, and another one has got early menopause at age 31, which is really shocking. But she was told she had CV. She was told she was given loads of diagnoses, and actually what her core, the root of all her problems, and she's been even more determined than me, I think, is that this is what's happening. Her body is going through the change early, and all her symptoms aren't CV or anything else. They actually are early menopause symptoms. But it's taken her to go to all different people like endocrinologist and all these other people, all these other experts, which she's paid loads of money out for to get her answers as well. So I think for me it's a feeling of don't feel alone, don't feel hopeless either. I've had some very dark patches where I've just thought, I woke up in the morning and I thought, I don't want to get out of bed. It's still here with me. I'm still living with it. I'd look at people in the street and I'd be like, I bet that lady over there hasn't got a sore downstairs, and I bet no one else is dealing with this today in the in this room. And it is funny what your mind actually does.
Absolutely. I can't even begin to imagine what you've been through. So as I said before, I think it's just such testament to yourself and the fact that you've persevered with it. But what you said with the menopause and with all these other symptoms, we get so many people that come to us who kind of, I think the vaginal microbiome indicates a lot of the time your menopause before it shows up in other tests. So it's kind of, it's just crazy to think that so few people kind of understand or know about the vaginal microbiome. And I think
UK Health Radio, the station that makes you feel good. UK Health Radio, The station that makes you feel good.
No, I think, Bev, it's also so important. We were kind of having a discussion before about how education about vaginal health and about even just vaginas in general is so important, and something that was definitely missing a lot for most part of your journey with regards to everyone surrounding you and even yourself. How do you kind of find that has kind of molded your experience? Or
I think the main thing is don't give up. I mean, along my journey, I've had, GPs saying, I'm really sorry, but I can't help you. I'll have to refer you, which is all that they can do. I know another GP had said to me about the DIV, that she'd never ever heard of it. And she was very dismissive, which was a bit devastating, because at the time I was very anxious, and you just want to hear that someone knows about it or can help you. It was during a review of my my antidepressants that I mentioned it. It was a phone consultation, and this particular doctor said, I've never heard of it in 20 years of practice. And I said, well, it is a real thing, because she was acting like she didn't believe me. She went, well, I'm looking it up now on my screen. And I thought, and then she was just basically cut me off quite short, really, because it was a review of my antidepressants. It wasn't particularly to go into this, but she said, I've got other patients to see today. And she was very dismissive. So I found that very, very unhelpful, and it just left me feeling very upset and quite let down again. And when I'd been prescribed the hydrocortisone for that particular condition, I actually went to my pharmacy to pick up a prescription, and he could see that I was upset, the pharmacist, and he said, are you all right? Do you want to talk? He was lovely. He took me into their consulting room that they have there, and he said, I told him all about it, and I said, it's going to be really expensive and I'm not sure if I can afford it, and and he said, well, I've heard of DIV. We've studied that. And it's this young pharmacist had heard of DIV. He said, yep, hydrocortisone, that's what will suppress it. And it was so nice to hear that someone had heard about it, and it was just a random conversation. But I came away from that sort of meeting feeling a bit more better about it. But yeah,
absolutely. I think even just hearing you, like, he, not even the fact, even if he didn't know so much about the condition itself, I think hearing you and taking that time to speak to you is something that's so important. I think we do that. That's why we do a free consultation with every single test that we do, is because we can agree more that it's the same thing, that providing that space where women feel heard is so rare, I think, unfortunately, because I mean, the NHS and doctors in general are under so much pressure. They haven't got time to know everything about everything, which is fair enough. But also, firstly, vaginal health should be studied way more than it is at the moment. And should be way more research into it. But I think it's hard for them to always provide that space where women feel listened to and empowered and feel as if someone really cares about them and is trying to do something for them. So I think, that's so,
It's funny, because in the very beginning, when I went to my doctor, I thought, well, okay, I've self-treated, I'll go to my GP and I'll get fixed up. Never in a million years did I think that 5 years on, I would be scrolling through the internet, finding any scrap of information that was anything like my symptoms. I literally spent hours. My husband used to say to me, I'm going to ban you from that in a minute, because I would spend hours just trying to find answers, because I'd lost all faith in healthcare, really. I mean, I'd been given that many different diagnoses and given that many different antibiotics, nothing was working. It's only when I did a private test that I got the answers that I needed. And I think, rather than treating people blindly, or people treating themselves blindly, these are so important, because all you're doing is guessing, and all you're going to do is, if you take antibiotics or too much canesten, is knock your microbiome even further out.
Absolutely.
I think I would actually be I'd probably be a lot mentally in a very bad place now, had it not been for me doing the research and finding somewhere where I could do a test.
Absolutely. And I think
definitely.
Even the tests that the doctors give you at the moment, they might test for one thing or one strain, but as you said in your own journey, the fact that you didn't have any of those things, because you had something like things that people like you didn't have any bacilli, then I think that that's why the full microbiome test is so important for people such as yourself, where it's getting that full picture. So screening 100% of the bacteria present. So either through the company that you used or our one that we use as well, screening that 100% of the bacteria present really gives you that full context and full understanding of what's going in. So then you now know, oh, the issue is not the fact that I've got too much of bad bacteria. Your issue was the fact that you've got no good bacteria, no good bacteria role, and the fact that you've got to have at least 95% and you on 0 just meant that there was no protection. So you're just susceptible to all of those things that you were experiencing. And I think that that's just something that's so important for people to understand. And it's so important. I'm sad that it's been taking you 5 years and that we weren't around when that was all going on to help you. But I think that it's, really empowering that you managed to go through it and educate yourself so much on it. I reckon you're up there with, more than most people or most doctors.
Well, my GP said that. She said, you'll know more about it than I will now. And I think the hardest thing for people as well is, even with getting the results of the test, it's then finding a doctor willing to prescribe based on it, because it's not their test. And that's one of the other challenges to overcome as well. I could manage to convince my doctor in London to treat me based on the results, but it took some convincing. And like you said before, Jess, you either fit in one of 2 boxes with most GP tests. They do a standard set of tests. You're either a thrush box or a BV box. And if you don't fit in them, then there's nothing wrong with you. Well, that's my case is proof that there is so much more that can be wrong, and various things can tip your balance. But there is just, it's just
absolutely. And I think it would save yourself and NHS doctors so much time and money and everything, and I mean stress, particularly on your part, and pain that you've gone through and discomfort, by just doing a simple test where it can just tell you everything that kind of is going on in there, and then you can address it with, like, as you said, a holistic, well-rounded approach. I think is the best way to address it. And do you still maintain that kind of approach now?
So yes, but I think antibiotics definitely have their place, and obviously Canesten does, and all those things. But it's making sure that the treatment is targeted. So rather than just going, I'm going to give you Augmentin to cover everything, or maybe certain bacteria don't actually respond to that antibiotic. I mean, all the research I've done is certain bacteria aren't actually susceptible to certain antibiotics. So it's finding the right one. So in my case, it may be that the cephalexin actually got rid of the fusobacterium, which were overpowering because I had no good bacteria to protect me. And then I did the regime of put the good bacteria back every single day without fail, 3 months solid.
And that is also an important part that I think, so many people, I think people want to just take a pill and it all be fixed. But I think it's that reintroduction of good bacteria. And as you kind of alluded to, the fact that shockingly, every woman's vaginal microbiome is different, just like every woman is different. So I think rather than saying, okay, no, you're either good vagina, BV vagina, or thrush vagina, and you're in one of 3 categories. Well, actually, no, everyone's got a complete, as you said, everyone's got a completely different composition, completely different relative amounts of different bacterium and absolutely everything. And I think that's something that really we're starting to see a move a bit towards more personalized medicine. But I think that's definitely evidence for that transition that needs to be made in healthcare in general, particularly with the vaginal microbiome.
I think for me as well, I always think something good's got to come out of every sort of journey and bad experience. So for me, the fact that I know so much more about it now, I just feel I can help other people as well. So like I said, with these groups, I'm still on all the Facebook groups and supporting my friends who are still struggling a little bit with some of their own conditions, although they are both improving, my friends, which is great. They've managed to find and carry on like I have and just be strong. That's my biggest thing is, if you're going through anything like what I've been through, just keep going and be strong and try and stay positive, because that's the hardest thing is, convincing yourself. I was utterly convinced I was going to be living with this for the rest of my life. And I'd kind of almost resigned myself to it in the end, because you have to carry on. But
how did you keep going? Yeah, how did you keep going in those situations?
Well, I've got a little girl and they're the best distraction, but I just had to say to myself, I just had to get on with it. And I think, for me, I just thought, I've got my own business. I can't let my team down. I've just got to keep going. And and although I thought I may suffer with this forever or not be quite right, I just thought, well, if it gets to a point where I'm not, as long as I get to a point where I can cope with it, then maybe I can, I'm just going to have to live with it. Well, you are going to have to live with it, because there isn't any choice, is there?
And I think on that note, unfortunately, we could go on for ages, but I'm going to have to bring this to an end as I'm conscious of the time. But I think, Bev, it was so, so, so lovely to have you on. And I think your story is super inspiring. I think it's been so brave that you managed to go through 5 years of this. And really, I'm so happy for you that you've got to a kind of end solution, or really on that pathway to recovery. And your story, I think so many people will be inspired by as well. And if anyone is going through anything similar and wants to get in touch, either with Bev or with myself or with the team at Screen Me, I think that's something that we're always here. Links are always in the description box. I think we always want to provide that space, whether it's a health practitioner or another kind of expert. We're always here to kind of speak to you and really address your issues holistically and as a whole. So thank you so, so much, Bev. And honestly, so lovely to have you on.